This patient was suffering from a pretty severe osteoarthritis of his knee. He had failed conservative treatment with medications, physical therapy, mobility exercises, as well as he tried 2 corticosteroid injections and had even tried PRP, was still having significant pain, which was affecting his quality of life. His job required him to do a lot of walking, so he was having to miss days of work, wasn't able to really enjoy doing a lot of the things that he liked to do. So at the same time, this patient did not want to do surgery, although he was a surgical candidate, was trying to put it off as long as possible. Today we did a genicular nerve radiofrequency ablation, or RFA, in order to help give him some pain relief and prevent or prolong his surgical course. So a lot of it was his job. It required a lot of walking. He's having to ambulate up and down stairs, go long distances, sometimes even carrying items while he's walking. So really, his job was giving him a lot of issues in terms of pain. So you have nerves that innervate or send signals from areas to your brain, right? And that's essentially how we can sense that we have pain somewhere. And so you have multiple ways of addressing pain that's secondary to a joint or that's intra-articular. You can inject directly into the joint, and the injectate can range from hyaluronic acid, or it can range from corticosteroid or PRP, or even just local numbing medication such as a lidocaine or a bupivacaine. But if that doesn't work, you can also block those nerves that signal is coming from. And so the knee joint is innervated by the genicular nerve and multiple branches of it. Blocking that signal is another way to help get pain relief for patients that either don't want to go to surgery, or they may have too high of a BMI or have other medical conditions that make their surgery a little bit more high risk. So this is something that we can do to try to help them. Or if the patient's already had a knee replacement, and obviously you don't want to inject into a prosthetic knee, the patient continues to have pain after they've had surgery. So the genicular nerve RFA is also a good option for folks who have already had a knee replacement but continue to have pain. Before we do the RFA, we do what's called a genicular nerve block. Instead of using temperature to essentially ablate or burn or destroy temporarily those nerves, when you do a block, you're just injecting some local numbing medication around those nerves, which is only going to last for like 4 hours or so. So we do the block first. Then we have the patient go do things that cause them to have pain while that block is still working, and we see if their pain is reduced by at least 70 to 80%. With this patient, his job causes him to have a lot of pain, and luckily for us, he had to go to work right after we performed his block. And so he came back 2 days later and he reported 90% relief. He was able to walk up and down stairs, do his whole shift without having significant pain. And so that's why we then proceeded to the RFA. My name is Dr. Aaron Bolds. I'm an interventional spine and sports medicine physician here at Barbour Orthopaedics Spine.